On the 28th of July, 2015, my uncle died. On the 28th of July, 2015, my uncle died, not because he had an incurable or fatal illness. On the 28th of July, 2015, my 52-year-old, economically active, previously healthy uncle died simply because he was not able to access quality health care timeously. My uncle was a contract worker, and so when he fell ill in May 2015, he was faced with one of three options. One, take the day off work and go to the public clinic. Now, for those of you who don't know what this entails, this means that he would have had to take the whole day off work, arrive at the clinic no later than 6 a.m., and possibly only get serviced hours later, if ever. This option brought with it the reality that he would lose his daily wages and possibly his job. Or two, go to the private doctor, where only the price of the initial consultation was known to him. He would have had no idea of what the other variables, such as medications, special investigations, or any other procedures would have cost him. And for someone on a tight budget, this option was too intimidating, too frustrating, too unpredictable, and perhaps not even an option after all. Or three, not seek health care and hope for the best. And so he did what most South Africans in his position would do and continue to do. He deferred seeking health care. And unfortunately for him, the best that he had hoped for turned out to be a disease progression so rapid and so aggressive that he ended up in ICU 6 weeks later in severe multi-organ failure. And on the 28th of July, 2015, he died. And that, ladies and gentlemen, is the reality of the South African healthcare system for over 40 million citizens. A system that implies, by its structure, that only the haves deserve quality. A system that has taken a basic human right and turned it into a luxury good. A system that needs to change, and that change needs to happen right away. South Africa spends enough on healthcare as a percentage of GDP. Actually, no. South Africa spends more than enough on healthcare as a percentage of GDP. In fact, it is so enough that it's actually comparable to that spent by developing countries or first world countries. But our more than enough is not translated into our healthcare outcomes because our healthcare outcomes are dismal. The World Economic Forum's Global Competitiveness Index of 2016-2017 rates us poorly in terms of the quality of our primary health care. And if you think health care is an isolated issue, it further rates us poorly, and by poorly I mean out of 138 countries, we are number 130 in terms of the business impact of easily treatable conditions such as TB and HIV. And that is because people with TB and HIV either have to take way too much time off work just to access treatment or are dying prematurely. And these dismal outcomes, despite our spend, our more than enough spend on healthcare, are a direct result of our structure. We have a dual healthcare system, which is made up of an efficient, well-resourced, but expensive private healthcare sector that only really is accessible to about 18% of our population. And 18% is the total number of people in South Africa in 2016 that are on medical schemes. So this sector is expensive because small population. It's expensive because static population, because it hasn't really expanded in the last 10 years or so. So really, it's expensive because exclusive. And on the other spectrum, you've got the public system, which is free. Or is it really? Because if you're employed, losing a day's wages is not free. Risking your employment, not free. And so we have both these sectors contributing to lack of access to healthcare, the private sector convenient but unaffordable, the public sector affordable or free, but highly, highly inconvenient. These are the challenges that Koala Health addresses. Koala Health is a paperless, technology-driven provider of high-quality, affordable healthcare in underserviced areas. Our first pilot is in Dieplsloot, and it started operating on the 1st of May 2016. Dieplsloot is around the corner from here. Dieplsloot has a population of between 600,000 to 1 million people, depending on which source you choose to quote. Densely populated is what you can't argue. Dieplsloot has 2 public health clinics, a scattering of GPs, and it is 40 kilometers away from the nearest referral hospital. And so we conceptualized Koala Health that is really premised on 3 main strategic pillars, and that is affordability, convenience, and quality. Our affordability is expressed not only in terms of the price that most customers can afford, but our affordability is expressed in having an inclusive price. An inclusive price means that it has to include medication, it has to include special investigations, it has to include any procedures. The healthcare system, unfortunately, is typified by what we call information asymmetry, which means as a patient, when you're sitting at home making a decision to seek healthcare, you have no idea what intervention you're going to require. And for someone who's insured, that is very, very frustrating. So we make it inclusive. Inclusive also means that should the patient need a referral to the definitive care, you provide that transport, because referring somebody without addressing how they're going to get there is not value-adding and, in my opinion, downright irresponsible. So an inclusive fee is predictable, an inclusive fee is inner peace, an inclusive fee is access. Now, you can't just stop at affordability, because as we've seen, it's not just about affordability, it's about convenience. Our convenience is expressed in the fact that we are community-based, and suddenly people can interact with a quality facility in familiar surroundings. Our convenience is expressed in the fact that we open 7 days a week, 12 hours a day. So we open every single day. Our convenience is expressed in the fact that we've got no queues. Our processing time, which is enabled by the technology that we use, is between 20 and 30 minutes. So no queues. What this means is that people no longer have to compromise their employment for health and no longer have to compromise their health for employment. So convenience means access. And the third pillar, and perhaps the most important pillar, is quality. Because you can make it affordable, you can make it convenient, but how do you ensure that the quality is of an acceptable standard? The technology helps us with that, because we are able to monitor health outcomes. We are able to populate the data and see which conditions are common so that we can gear our in-service training and make sure that our providers are fluent and are excellent in those conditions. Because one thing that I learned at medical school is that common things occur commonly, and the best practitioners are the ones that excel in the most common conditions. And our system allows us to do that. But quality also comes in the softer aspect, and that is in the aesthetics of the facility. We made sure that the facility is of a pristine condition, is of high standards, because just because you don't have money does not mean you should experience shoddy facilities. We ensure that we restore the dignity and respect that is often so lacking when people service this market. Our convenience is also expressed, or our quality rather, is also expressed in the fact that we've got friendly staff and we incentivize staff to be friendly and to treat our patients like guests, and that is what we refer to them as. We refer to them as guests. I was recently criticized for building a brick-and-mortar business in 2016. This person's rationale was, we should be more technology-driven and we should be driving businesses that are more technology-driven and that, therefore, is more sustainable. My answer was in 3 parts. First of all, we are technology-driven. We are a paperless environment, and the technology allows us or enables us to deliver on our 3 strategic pillars: affordability, convenience, and quality. Without technology, we would not be able to do so. Secondly, these areas, like Dieplsloot, do not have brick and mortar. So when you have an ectopic pregnancy, or you've been in a car accident, or you've got a gunshot wound, you need timeless physical care, not a Fitbit. And thirdly, we've got a country with an unemployment crisis. Our unemployment rate is 25, 30, 40%, depending on which source you want to quote. And therefore, it is responsibility of business to make sure that whatever businesses we build are inclusive and they absorb that. And this then brings me to the next issue of what does quality health or a quality health-like facility mean for the South African economy? Firstly, it means jobs. Our Dieplsloot facility employs 50 people, and with a targeted 100 facilities, you do the maths. Okay, I'll do the maths. It's 5,000. The answer is 5,000 jobs. And it's not only about creating these 5,000 jobs or the potential to create these 5,000 jobs, but it's in the type of jobs that we are creating. We're creating jobs that are correcting for the spatial configuration left by apartheid, because all of a sudden people don't have to wake up at the crack of dawn to go to work. So they've got more time for themselves, for their families. All of a sudden people don't really have transport costs to go to work, so they've got more disposable income in their pockets. All of a sudden, people are given the opportunity to provide a service in their language. And this was expressed recently by one of my nurses who said, you know, Dr. Legoete, I suddenly realized I'm not stupid, I'm not incompetent, I just don't know how to speak English. And in our environment, not a big deal. And secondly, what quality health or a quality health-like facility means for the South African economy is that we are opening up the private healthcare sector. We are making it more inclusive. We are making it more accessible to more than 18% of the population. Each facility has the capacity to service 300 to 350 people, and if we're targeted 100 facilities, that means we'll be providing access to 35,000 people in this country daily. Somebody recently asked me if I miss being in the private sector, and my answer, I was very confused because I am in the private sector. But in Nthabiseng, should the government not be worrying about this? Should the government not be the one that takes responsibility for the healthcare of the citizens? Absolutely. But I often meet that kind of narrative with a blank face, and my blank face is whatever blankest face you've ever seen, multiplied by infinity. That is my blank face. And I do that not to be cocky or anything, but I do that because those conversations or that narrative doesn't move us forward, and it doesn't change anything. Those conversations don't have the potential to create 5,000 jobs. Those conversations don't have the potential to provide healthcare to 35,000 people daily. Those conversations don't actually matter. Quality healthcare should not be limited to the haves. Quality healthcare should not be and is not a luxury good. My mission is simple. I want to democratize it. Thank you.